Hello everyone, it's Ashley with Amare, owner and founder of Amare Healing Arts, Plastic Surgery Recovery Center, and Holistic Clinic, specializing in manual lymphatic drainage. We have 2 locations in New Jersey, Highland Park and Elizabeth, and I also offer virtual consults. If you're not in New Jersey but still need help with your recovery, you can give the office a call at 732-841-0142 to set up your sessions. We have our post-op shop where we offer post-op supplies like lipo foams and BBL pillows, and I teach you guys how to use those products with the videos that we have on our product page. That's amarepostopshop.com. We also have our online courses where I teach you guys what massages you would need after plastic surgery, when to get your massages, who to get them from, what the lymphatic system is, what lymphatic massages actually are, and all the research that you would need on your post-op massages and finding a lymphatic therapist. All of these links are in our bio as well as in the description boxes, so you guys can go and check that out. I will see you guys soon. Ashley with Amare. Bye.
Hey guys, Ashley with Amare. So today we are going to talk about high definition ab etching. So I posted a before and after where a guy came to me, male client, and he had liposuction done. And his doctor was like, oh, we could just throw in some ab etching. And he was like, ab etching? Okay, I mean, I guess. I want abs. That's cool. Didn't really know what it was. And then he winded up with what he called a gut with cuts, where he still has all the visceral fat, all the fat on there. And then he had lines, like a tic-tac-toe board, on over the fat. And you can check out our Instagram to see that. So he was not very happy. Now, we were able to get it to look as normal as possible, get all the swelling down, but those lines are still there, and they're permanent. Why? Because surgery is permanent. Here's the thing. What is ab etching? So, you know how when you go to get like a facial and they're like, oh, would you like to do this cucumber mask? And you're like, oh, I like cucumber. That's so great. Let's do cucumber. And it's all like, okay, but you don't really know what's in it. And you're just like putting it on your face. And it's like, oh, okay, it's an add-on. It's cool. A lot of surgeons treat ab etching like an add-on. Here's the thing. Ab etching is a high definition liposuction technique. Now let's get something straight. Again, as I do in every lipo video, lipo is not weight loss. You will not suddenly lose weight from lipo. Lipo is sculpting the fat that's already there. So that being said, when you actually lose weight, your results are going to look better, right? Or I should say stand out more, right? But it's not going to make you lose weight. It's not going to give you abs, right? All it's going to do is shave off the fat from over your abs, and your abs are going to show through. So let's talk about abs for a second. When you go to start building up your abs, right, or you're like, I want abs. I'm going to do research on how to get abs. Yeah, I'm going to do crunches, and yeah. Okay. Abs are made 80% in the kitchen. That is a true statement. Any bodybuilder, anybody that's cutting for a show knows that. It's about diet. It's about getting the fat off of your muscles and then defining and toning your muscles. So crunches, yes, they do work. But if you still have all that fat on top of your abs, you're not going to see your abs as much. Or you're going to wind up with abs like chunky sticking out and then fat on top of that. So when we're talking about ab etching, it's something that's done with liposuction. Ab etching is liposuction, but it's high definition. So what does that mean? They go in with the cannula, they lipo you out, they sculpt you out, they cut all the fat off of the ends, right? They shave off all the stuff. Then they go a little bit more superficial, lining and carving out the lines of your abs to make your abs stand out more. So they'll take the fat off of your abdomen, right? They'll get you nice and flat, and then they'll go in just beneath the skin a little bit more and sometimes a little bit deeper. They'll go in there and they'll take the cannula and they'll trace and carve out a little bit more fat off of your abdomen. So that's how you get your abs to show through, because they take a little bit more fat off and it causes definition, hence high definition liposuction. So, a couple things. Let's take a look at this picture. So this is my plastic surgery textbook, High Definition Body Sculpting, by Dr. Alfredo Hoyos. These are your abs. Everyone has these things, and then all this purple stuff is like fat that's all around you, right? And that's in this picture where they're going to be sculpting. So this purple is where they're actually passing the cannula to do the sculpting on your abs. Okay, so couple things. Not every surgeon can do this. This is a technique where you have to actually be like trained in high definition liposuction. Traditional liposuction will help show the musculature underneath. So again, we already have abs. Everyone in the world 24/7 has abs. Whether they're big and defined, whether they're flat, they're there. So when you're doing traditional liposuction, if you're just taking off all the extra fat, your abs may show through naturally, but they're not going to stick out and like really be defined. So one of the things in this book that they make very clear is always know the real anatomy of the patient, no matter how awkward it may seem. If you fail to find and achieve the rectus inscriptions, the actual like ab lines, rectus inscriptions, when the patient starts dieting or exercising, they will observe double inscriptions and failed results. Like my client, they will have a tic-tac-toe board on their stomach because you're not following the natural anatomy. So the point of ab etching is to follow the natural lines. Now, there is an article on ab etching on high-definition-liposuction.com, which is for high-definition liposuction, that says if you are not 18% body fat or less, they do not consider you a candidate for high-definition ab etching. Why? Because we need to be able to see where your abs are. Now, why do we need to be able to see where your abs are? Why can't we just carve out abs out of nowhere? Because not everybody's abs are straight up and down like in this book. Some people's abs, one is here, one is there, and then two, and then two, and then one here, one there. It's something called asymmetry, which means it's not symmetrical, it's asymmetrical, so it's not even. Bodies are weird, guys. Not everything is even all the time. One eyebrow may be curved differently than the other. One, facial structure thing may look different than another. Same thing with your abs. Your abs are not just like a perfect cut tic-tac-toe board. So when they do ab etching, and it's a surgeon who is throwing in ab etching, but you may not actually be a candidate for it, you're going to wind up with artificial lines on your stomach and not be happy. That's the one thing that happens. The other thing that happens is you guys don't really know what ab etching means, and you're like, oh yeah, I want some abs, sure. And the surgeon doesn't really go into depth about, okay, this is what you're going to look like, and you wind up with abs sticking out. And you don't like it. And as you're healing, you think there's something wrong with you. You're like, oh, I had lipo, and now I have like these lumps sticking out of me on the top that I didn't have before. What are these lumps? Are they a seroma? Are they swelling? Is it fibrosis? And you go down this rabbit hole of complications. Again, guys, regular liposuction, your abs will show through. You don't need ab etching to show your abs through regular liposuction. Those are a natural anatomy thing that's already under there. So as we take the fat off and as your skin retracts, they're going to poke through. You're going to see it. So you guys start freaking out because you're like, I thought I was going to be flat. Well, you are flat, but you have natural musculature that's coming through because you don't have any fat on top of it anymore. So it's about the look that you want. And this is going back to this point that I was just making. When you're talking to your surgeon, you want to make sure that you're getting the look that you want. So you guys bring in your wish pick, right? And it could be a picture of you 10, 20 years ago. It could be a picture of someone else who has kind of the same body as you. But you want to make sure that when you're talking to them, you're like, okay, this is what I want to look like. I don't want to see all these lumps on my stomach, like abs poking through. I want to just look flat. In that case, they may leave a little bit more fat on your abdomen so that you're soft and contoured and you're not hard with abs. Now, I'm going to show you something. This, right, is before and that's after. This is ab etching. This is what it looks like. So you see how you can see the lines on her stomach poking through? Oops, I don't know where it went. Poking through. That is ab etching. That's what that looks like. When you're talking about ab etching, you need to make sure you understand the look of what it looks like and what you want you to look like. So again, talk to your surgeon about this. Be like, okay, you know what? A little bit of ab etching where we're just doing the midline, sculpting it out a little bit more is fine, but I don't want actual things poking through because you guys freak out and you think, oh, wow, like now I have all these lines all over me I didn't have before. There's also the case where surgeons will just throw in ab etching that you didn't ask for, and now you got some lines. So make sure you're talking to your surgeon, first and foremost. Second thing, make sure the surgeon that you're going to, if they're going to do ab etching, knows what they're doing. Make sure they're actually understanding the technique. Ask them questions about what they're doing to make sure that they're not just carving out lines under your skin, to make sure that they're actually following the natural asymmetry or symmetry of your abs. Now again, usually they say, again, you want to be between a certain body fat or under a certain body fat so that it looks natural. And then also be aware, if you gain weight again, those lines are permanently carved into your body. If you gain weight, it's gonna start looking kind of weird if you're doing ab etching or you just get it thrown in. Because if your fat and your stomach starts to extend, those lines are under your skin. So you're gonna wind up with the gut with cuts look. So there's that. Now, let's talk about the difference between regular ab etching and lipo, because both, we can get abs with both, right? We can have our abs show through with both. But what's the real difference? Okay, so Healthline has an article, kind of iffy on Healthline. Some of their stuff is not the most accurate, but I do like this article. They have an article on ab etching. It's what is abdominal etching. And it says abdominal etching is similar to traditional liposuction in preparing for surgery and recovery time, and it's a very similar procedure. The results of ab etching are much more prominent and dramatic than traditional liposuction. It also may be more expensive because the provider who is trained in it is actually trained in the specific procedure. So, again, what that's saying is when you're doing ab etching, it's making your abs more prominent and stick out. Again, if you guys don't want that kind of a look and you just want to look flat with like normal light looking abs that don't like poke all the way out like that picture I showed you, you might not want to do ab etching. You might just want to tone and define. Now, that's not to say that your abs won't get better. Again, after the liposuction, you're going to be working out. When you start doing crunches, those muscles and those ridges that you're seeing are going to get more defined anyway. And you're going to continue on your weight loss journey. And you're going to be taking all that stuff down even more. They're going to be more prominent. You're going to see them. So is ab etching necessary? In my opinion, no, it's not. Because you can do the work for the high definition part of that and not have to get high definition liposuction. High definition liposuction is, again, where they're sculpting a little bit more underneath the skin. So you can get ab etching if you want abs like now. If you really want them to poke through and see through and you want to have those like cuts, you absolutely can. Here's the other thing, guys. Ab etching is not just all the way around. They can do ab etching of just the top line and just the sides. So you don't have a six pack, but you have nice soft curves. They can do that too. They etch out your obliques a little bit more. They etch out your linea alba in the center a little bit more so that your skin is more flush up against you so you don't see your full six pack, but you're getting a sculpted shape. That is also a form of ab etching. They're not etching every single piece of your six pack, but they're etching and sculpting the abs themselves. That's usually done in traditional liposuction to give you a shape. But again, ab etching in high definition liposuction, when you're really asking or getting ab etching, they're going to sculpt out every single piece. Not always, again, you can talk to them about that, but that's generally what that means, is when you're doing ab etching, you're sculpting out all the abs to get them all to poke through and show through every single one of them so that you see your full set of abs. On ladies, it's usually a 4-pack. On men, it's usually a 6-pack. It depends on what you're asking for. It's all subjective between you and your surgeon. Now, let's talk about healing for this. So when you're talking about doing ab etching, regular liposuction, as we know, takes off the fat, right? You then have swelling coming in. And then if you don't take care of the swelling and get it out and heal yourself, it turns into fibrosis, which is really hard and thick. And then after a year to 18 months to 24 months, it becomes permanent scar tissue. Everything before that in that 12-month range, we can get that hardness to go back to swelling and you pee it out. You are not supposed to be hard and plastic and stiff after liposuction. That is not normal. Does it happen? It's called fibrosis. Does it happen? Yes. Is it normal? Is it required to happen? No. I have tons of videos on fibrosis on my YouTube. You guys can check that out. But the reason I'm bringing this up, you're talking about another layer of work with ab etching. Not just the regular sculpting of lipo, which we will get fibrosis from if we don't take care of it properly afterwards with aftercare and MLD and all the stuff that I talk about in all my other videos. But you are talking about an extra layer closer to the skin or sometimes a little bit deeper, depending on what they're doing. But it's generally right under the skin where they're sculpting out a little bit more to give those shadows and those appearances and that little bit deeper work so your abs can come through. So they're taking off a little bit more fat there, which means you will have a little bit more trauma, which means you will have a little bit more swelling, which means you will have more fibrosis if you are getting fibrosis. Now, here's where this goes wrong, where you wind up with a tic-tac-toe board. You turn that swelling into scar tissue to try and keep your results. That's not how that works, guys. You don't need to stick a pencil. So what happened with my client, the one that I have that before and after that I posted, they had rods, like metal rods, wrapped in plastic, taped to his abdomen in these lines, but they weren't straight. and his body started healing around those rods and creating scar tissue around those rods, and now he has uneven slanty lines on his abdomen that are supposed to be ab etching. When you do ab etching, the work is already done. The work is already underneath all of that swelling. Doing something like putting a pencil or rolling up a piece of foam or gauze and taping it hard against your abdomen is only going to make artificially hard lines on your skin. That's not going to give you your results. Your results are already there. They're underneath the swelling. So doing something like that, or using your thumbs and raking, or having a massage therapist using her thumbs or a tool or whatever that massage therapist is using, raking through where the ab etching was done, that is an area that already has twice the amount of trauma and twice the amount of broken tissue, superficial underneath the skin and into the layer where the fat was. You are now causing 10 times more damage to that area. It is going to scar and look weird and become hard and fibrotic 10 times quicker because of the amount of trauma to the area, and you're adding more trauma by using wooden pipe things and metal pipe things and rolled up pieces of foam and all kinds of craziness, and digging and raking. All that extra trauma on an area that's already extra traumatized is going to make really hard scar tissue and make you look artificial. So if you've had ab etching and you have those really hard areas that feel like cannula lines, they are cannula lines from the cannula going in there and sculpting you out. If you have those really hard, thick cannula lines where the ab etching was done, and you are using strips of foam or pencils or pipe cleaners or raking your thumb through it, you are building up scar tissue. You will never see your results. It will look artificial forever, because you are basically telling the body, hey, trauma, 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 fix this 10 times harder so that the next time somebody puts their thumb in there, we don't feel it because it's thick, thick, thick pad of scar tissue. That is not how we need to heal. The results are under there. We need to get all of that swelling down. We need it to be soft and flat. Again, think about this. Dr. Alfredo Hoyos, in this plastic surgery textbook, told you you are carving the natural lines of the body, right? How are we going to think that using a pencil or something artificial that is not the natural lines of the body, pushing it into there, is going to make that heal? It's not. You're going to create artificial hard lines after your ab etching, and that's going to be what they look like. They're not going to look like your abs. It's not going to be soft definition. Now, how do we do this? You need something soft against your body to create that soft, flat environment so that your abs can start healing and that tissue in between can start healing soft, so you see your natural asymmetry of where the work was done. Those natural lines that were carved need to stay natural. Do not put artificial things on them. I know I've said it like 5 times, but guys, this is where everybody messes up. The Amare lipofoam is meant to sit flat right over there, so all of the excess swelling that's sitting on top of your abs goes away, and then as that goes away, the foam sit against your natural carved out lines, and it gets all the swelling out from in between your abs where the cannula went, so that it heals properly without having something digging into it and making artificial lines. So Amare lipofoams, link in bio, post-op shop, all of that stuff, it's there. It's on, the link will be on this video, at the bottom of this video. And the link is also on our bio on YouTube, bio on Instagram, or the Amare post-op, just Amare, postopshop.com, the lipofoams. Put one of those in there, and then 2 on the sides in your garment, and that'll help flatten it out so you stop having those hard, thick, fibrotic, rigid lines over your ab etching. Anyway, moving on. So it needs to heal naturally. Again, that work was done under there naturally, carved out naturally. It needs to heal naturally the same way. Otherwise, you're going to heal with artificial lines. Now, again, that being said, you had extra work done there. You're going to need a little bit more like intense aftercare, if you want to say, or be more on it with your aftercare and really taking care of yourself a little bit more. So that means making sure your garment is proper, making sure you're not using boards or all these weird hard things against your body, making sure you're getting proper manual lymphatic drainage from a proper certified MLD therapist, not somebody who's going to use oil and rub you. If they are using oil and rubbing you, those lines are not going to heal properly because you're doing more trauma to the area. So if you don't know what proper manual lymphatic drainage is supposed to be after surgery to help your body reabsorb the swelling from those areas so that you pee it out and it doesn't become hard. I have tons of videos on that on YouTube as well, and on the Instagrams, so check those out. But things to be super, super careful of after surgery with healing, because again, the ab etching doesn't go wrong when the surgery is done. It goes wrong with the healing because you're trying to artificially create lines when natural lines were just carved into you. And then you mess up the whole thing. So, no hard things against your body, no pipe cleaners, no hard thumbs raking through you, none of that stuff. It will make more scar tissue and your lines will not look natural. Number 2, making sure you're wearing a garment that is compressing you properly and not over compressing you, because it will trap fluid in those ab etching areas. Number 3, being on top of it with your manual lymphatic drainage sessions. Generally, every surgeon is different, but generally 48 hours after your lipo, whether it's regular lipo or ab etching high definition lipo, 48 hours after, unless your surgeon says you are going to have drains and they don't want you coming in for a certain amount of time, you follow your surgeon's orders always. Always follow your surgeon's orders. And then, last thing, make sure that you are understanding what you're doing before the surgery. Ask your doctor about the ab etching. Ask your surgeon. Be like, hey, what is this thing? I want abs, but what am I going to look like? How dramatic is this going to be? Because again, remember with ab etching, it's just underneath your skin. It's pretty dramatic. It stands out. You don't want something that you don't want to get done to you because you didn't ask the right questions or ask questions at all. Again, I'm saying it again, a lot of times you guys will get regular lipo and come in freaking out. I mean freaking out that you have this patch and you think it's a seroma and you think it's swelling and you're freaking out and you're like, I don't know what this is. What is this? And it's just your abs. It's normal musculature. And at that point, I let you feel my abs. And I'm like, hi, you feel these things? Yeah, they're supposed to be there. Or down by your pubic region, you have a V and you've never had a V before or seen that pelvic V where all the muscles are, the rectus abdominal muscles come down. And you're like, what the heck is this little line sticking out? I'm like, hi, those are your pelvic muscles. Those are your abs. They keep you together. You need those. Those are normal. But you guys have never seen this anatomy before because it's been covered by fat for so long. You have no idea what it looks like. So it looks even crazier when you get high definition work done like ab etching and you're like, holy crap, what are these things sticking out of my body? And you're not happy with it. It sometimes is better to leave a little bit of fat on and give you a more natural look and let you do ab exercises and crunches and go to the gym and do what you're doing to bring those out and highlight them naturally than do them artificially because you will not be happy with them. Or if you have a surgeon who's kind of knows what they're doing but doesn't really specialize in ab etching, they can do it, but they're not a specialist. That's when we get in trouble because again, then you wind up with the lines on top of the fat and it doesn't heal right, or you do the aftercare things that don't heal right. So, wrapping this up, ab etching is where they do a little bit more work to sculpt your abs. Healing from ab etching is almost the same as healing from regular liposuction. You just need to be a little bit more concerned with your aftercare and a little bit more on top of it with your aftercare. It's not a big deal. Having fibrosis afterwards, yeah, because you guys do all this crazy stuff. It does happen, but it doesn't need to stay there. Your ab etching should not feel hard. All of this should not have hard lines. And then you're like, well, they did ab etching and they messed it up. They didn't mess anything up. That's not a lipo issue. That's a healing issue. That's something completely different that we can fix. That being said, if you have hard lines on your body, hard cannula lines from ab etching, if you have fibrosis, if you have the Amare lipofoams and you're not sure what to do, or you have all that fibrosis and you're like, okay, I don't like the way I look, this feels hard, this feels weird, and my surgeon is just telling me to wait, and you guys want to be a little bit more proactive with your aftercare, call the office, 732-841-0142. Set up a virtual with me. Alex will be able to get you on my schedule if you are not in New Jersey. If you are in New Jersey, you can come in for a post-op session with me. Or if you're thinking about doing ab etching or liposuction and you don't know what's going on and you have your pre-op with your doctor and you're like, help, I want to make sure I'm doing all the right things, doing a pre-op with me in New Jersey, 732-841-0142. Call Alex. She can help you figure out what kind of session you need with me. Like I said, if you're not in New Jersey, we do virtuals as well, and we can kind of get you straightened out as far as your ab etching and how to heal it. And again, guys, the only thing, if you take away anything from this video, is when they say ab etching, please question your surgeon. Make sure that is something that you want, because those lines will be permanent. The definition that you're getting will be permanent. The way you look will be permanent. And it will be even worse and permanent if you're not taking care of it properly as far as healing. So call the office, 732-841-0142. Happy Alex will help get you figured out as far as what you need. I hope this was helpful as far as like explaining to you guys what ab etching is, and how it works and all of that, because this is something that I get a lot in my office, where you guys come in and you're like, yeah, and they did ab etching. I don't know what that means, but they did ab etching. And I'm like, oh, okay, we're going to explain this real quick. So I did a video. I will see you guys soon. The lipo foams are in the post-op shop, Amare post-op shop. Link will be in all the bios as well as at the end of this video. And I will talk to you guys soon. Have a good rest of your day. Bye.